I'm Daniel Washburn. I'm a medical doctor, MD after my name. I'm an endocrinologist, but first I was an internal medicine specialist. Internal medicine is adult medicine for the most part, taking care of a wide range of chronic diseases. Endocrinology is glands and hormones, primarily diabetes, thyroid problems. I also do very well with cholesterol, osteoporosis, and a variety of other hormonal issues. Most of my patients that I see here in the office have diabetes. Most of them have type 2 diabetes, but there are a few that have type 1, usually attributed to children or young adults. Type 2 diabetes is very common in Oklahoma. Unfortunately, it's because we don't eat right, we don't exercise enough, and it's frequently a little bit too much weight on board. I also take care of a lot of thyroid problems. Sometimes they're overactive thyroids, sometimes they're underactive thyroids. But that is something I specialized in and did extra training for when I was in my residency and my fellowship. The other things that we take care of in metabolic issues are things like cholesterol, osteoporosis, and another very common problem that I see quite often these days is a condition called hyperparathyroidism. The parathyroid glands live behind your thyroid, and they normally regulate the calcium and the other minerals quite well. But it seems like it's becoming a very common problem for me to see with people having too much calcium and too much parathyroid, causing calcium stones and potentially causing bone loss and fractures of the spine and the back. I opened this office in 1981. I immediately became affiliated with St. Mary's. In fact, they helped us with the office and helped us get our staff for our initial office visit. So I've always been part of St. Mary's now for over 44 years. I'm still very close to the hospital, and that's my primary utilization for x-rays and laboratory. What I am very good at is explaining conditions to the patient. I can explain to them what's going on, what we can do about it, how we can treat it, and what are going to be the outcomes. I joke and say that that's my superpower, is to be able to explain things to people, because that's what I do every day. I don't do procedures, and so I explain people their condition and then try to teach them how they can take care of themselves and make the condition better, or what we could do to help with medications to make them feel better. Well, my life revolves around my practice. I love doing what I do. I love coming to work in the morning, but I also enjoy going home to my wife and now 8 dogs. I used to be very involved with our community theater, the Gaslight Theater here in town. I did 36 plays in 25 years, but I've kind of retired a little bit now. But I still enjoy talking to people, and even situations like this where I'm somewhat performing. I enjoy explaining things to people, and I used to give a lot of talks back when the health department was very active in terms of diabetes. And I kind of wish we were still being able to do that again.